welcome everybody. My name is Maria Newham. I'm the Executive Director of Nursing AHPs and Quality. It was very nice of them to put the slide up so I could remember who I was today. I just want to say a huge welcome to everybody. It is the 23rd of September. Can you believe where the year is going? I cannot. I was saying to people this week, actually, I have started doing some Christmas shopping on Sunday. There was an opportunity. Where is the year gone? We've got a slightly different format this year, so I just wanted to say that we're doing question and answers after each section, and we've got some fantastic speakers who are just going to give you a brief around some of the work that they have been doing across the organisation. But I also wanted to just put a bit of a plea in, rather than me making up some questions, which honestly, you just don't want to hear the kind of questions that I want to hear. Try and put some questions in the question box on the right-hand side into the chat, and then we will try and get back to you. It'll be really good for you because it's an opportunity to ask lots of different people on this Connecting Knots today that you might not normally have access to, or you're not normally seen, or you don't know who they are. So it's a real opportunity for you to be able to ask questions from people. Like I said, we've changed this format slightly. I hope you like it. You can give us some feedback at the end as well. So we've got some great speakers, but it's always a very big pleasure for me to hand over to our chair, Paul Devlin, who's just going to give you a couple of minutes update and brief, and over to Paul, please.
Thanks very much, Anne-Maria. Hi, everybody. Paul Devlin, Trust Chair here, and good to be with you again on a Connecting Knots call. And I'm really conscious that it's still incredibly busy out there. I'm sure John will say a bit more about that, and I know there's a lot of additional activity building up now around flu and also boosters, which just adds to the mix. So just to start by saying, as ever, big thank you to you all for all that you're continuing to do, the pace of things and the amount of work that you're keeping going, bringing back on stream, and just doing our very best collectively for the people who need our services. There's a lot going on in Nottingham and Nottinghamshire around the integrated care system as well, and alongside all of those sorts of things, it's great to take time like this session to focus in on some really important topics. And as Anne-Maria said, we've got some important ones, and I'm really pleased to say that today I managed to actually get to go and visit one of our teams over at the Gartree prison over in Leicestershire. I'll say a bit more about that a bit later on, but it was just so good getting out there. Bluntly, it's so good seeing people in 3 dimensions rather than just on the screen. So that was a really interesting morning for me as well. But look, I'm going to stop there, looking forward to the whole of the session, and I'm going to hand across to John for the Chief Exec update. John, over to you.
Thanks, Paul. Afternoon, everybody. John Bruin, Chief Executive. Ordinarily, I get a 10-minute slot, but due to everybody's feedback, I note that today I've got 3. Thank you. So I'll be brief. To reiterate Paul's comments around the busyness of systems, I know I might sound a bit like a broken record, but this is right across all the different sectors in health, from primary through community social care, as well as mental health and the services that we provide. And I think it's safe to say that it's these are some of the busiest and most challenging times those of us that have been around a long time have ever witnessed. And it's really important to acknowledge tremendous work all staff are doing into maintaining the services that we're providing for our patients, service users, families and carers. So huge thank you. Do appreciate the challenges of providing services at this time. Everywhere is busy. Staffing challenges is, I know, on so many managers and leaders' minds. And unfortunately, I don't think it's going to be going away anytime soon. So the primary focus of a lot of our work at the moment is making sure that we can support staff wherever we can, whether it's simple things like making sure that you take breaks, whether we make sure that you take leave. We're hosting the staff health and wellbeing services. There's a whole range of options in there that can provide some additional support. And I wish we could say that in a couple of months it will all be over, but unfortunately, it's, as everybody knows, it's not that straightforward. So I think it's going to be a good few months of challenge. But thank you to everybody for what they're doing. I'm also really looking forward to a good update from some really interesting topics today. But by way of finishing, I just wanted to flag a particular service that we don't necessarily hear a lot about, that have come under the spotlight with regard to the vaccination programme, and that's the school age immunisation service that runs out of our community health division. And so as part of the national vaccine programme, we are now offering COVID vaccinations to 12 to 15-year-olds, and the school age IMS team are doing that for Nottinghamshire, and commenced their offer of vaccines earlier this week. There's lots of logistics and technicalities to get that operational, and just wanted to acknowledge the tremendous work that's gone on across not just the system, but also within all our enabling services in the organisation to enable that to happen promptly, with some really good, strong uptake initially in the first couple of days. So it just gives you a flavour of something else that we do and that we do well. So thank you. Looking forward to a really good session. I'm going to hand over to Lorraine Hooper, our Director of Finance, Information and Estates. Lorraine, over to you.
Thank you, John. So you might have had 3 minutes. I've got a whole 5. I'm gonna just briefly talk to you for a few minutes now about a couple of updates on finance, information and estates, so the things that sit in my portfolio. So I'll talk to you first about finance, if I can. I could flick on one slide. So we've had, because of COVID, some very strange and different financial arrangements in place in the last 18 months or so. And the biggest element of that has been about receiving costs to cover all, receiving income to receive all of our COVID costs, and our efficiency targets, what some of you might know as our financial improvement programme, have been paused for that period of time. Some of you might also have seen in the news over the last few weeks, there's been a lot about Nhs Money and finances. So there is some more money, 5.4 billion coming from the second half of this financial year, and a new health and social care levy from next year. We don't know quite the precise nature of those things yet and what they mean in terms of money coming for our services, but we do know things like the mental health investment standard will continue to be invested in, and there are some pots of money that we can look for investment in things like our buildings and our estate. What we also know, though, is that we expect our regulators from a financial perspective, so that's NHS, E and I, to ask us to start to turn back on our efficiency programme, our FIT programmes. So we expect them to ask us to make a 3% target. And that is in line with what all of our peers will do, both in the system and nationally. There's 2 reasons why we do that principally. One, to keep us financially sustainable. Looking after our money is an important part of what we do, but also to enable us to invest in our services. And to give you some idea, those bottom 3 bullet points there are the kind of things that we are able to do when we are efficient and look after our money well. So things like the eradication of our dormitories. That's a 50 million programme over many years. And £12 million that's going into our infrastructure, our buildings and our IT and our capability there. So it's really important that we continue to be efficient with our services. It's difficult, it's a hard number. 3% is around about £15 million for us as an organisation. But what we're making sure that we do is we focus on those real areas of both waste reduction, but also where we can transform as well. And 2 areas of my portfolio are key of that, making sure we use our buildings wisely and we use our space well, but also making sure we use our digital services to transform the way we provide patient care. So that's a little bit of where we are with money. I'll move on next. I think, is it digital next? It is, that's good. So a few bits on digital just to give you an idea of some of the things that we're up to. So System 1 and EPR has been rolled out at Lingsbar in the last few months. That's still an awful long way to go. If there's any of you here from Lingsbar, I'm sure you know that, but a really positive thing that we've started to make more digital our patient records there. On a real practical infrastructure basis, we're improving our VPN and Wi-Fi connections. So that's all about how you connect in and how you can use the very basics of our IT tools. A big thank you to all of you that completed all of your information governance training. A big part of what we have to do with our IT services is make sure that they're safe and fit for purpose, and that's particularly around the threats of cyber security, making sure phishing attacks and those sorts of things are kept at bay. And part of that is making sure we're all trained in information governance and that we comply with what's known as the Data Security Protection Toolkit. And then very practically, we are aware that there are some things that don't work to their optimum every day for everybody. So what we've established is a user group, a task and finish group with users represented from across all of the divisions to try and look at what those areas were. One of the first things that group has done, and you may have noticed this already, is remove the internet quotas. That's not to say obviously we should now all be spending all day on the internet, but now the ability for you to do your jobs and to use the internet is uninhibited. And we're also working really hard on what our digital ambition and strategy is, what the digital revolution should be, if you like. And we're working really hard with external partners as well to make sure we can bring in some money to enable that. So last but not least, very quickly, because I'm going to have run out of time, is just some bits on our estates and facilities. So I've already talked about mental health. Practically, we're working through visiting areas where it's safe to do so, given COVID, about what works are being done. If you've got works that need to be done in your areas, contact the facilities help desk, and we keep a really close oversight now on those jobs that need to be done in detail. Myself and Anne-Maria get a list every couple of weeks of the kinds of things we need to do. We know there's a big list and we are working through it, so just want to assure everybody that we are doing that. And the last one on there I'll just pull out, given time, is the net zero plan. So climate change, I'm sure everyone aware, is a real big issue. I'm going to give you a stat now that I heard last week. So the NHS is responsible for 4% of the global carbon emissions, and the airline industry is in fact only responsible for 2%. So a real focus on sustainability for us as an organisation is something that we're looking at, and I chaired this week for the first time the net zero group for the organisation. So a bit of watch this space on what you can do to help get us to a net zero carbon position. And I'll stop there and hand over to Rachel Lees, who is going to talk to us about suicide prevention.
Thank you. Hi, yeah, I'm Rachel Lees. I'm the Trust-wide Clinical Lead for Suicide Prevention. I want to take the opportunity to give a bit of an overview of the Trust's approach towards zero suicide, but also reflect on this year's theme that we had for World Suicide Prevention Day, which was the 10th of September. And the theme was about creating hope through action. And we had lots of conversations around the Trust and about that and what that means and things that we can all do to try and prevent suicide. Can I have the next slide, please? So our approach towards zero suicide is it recognises that suicide prevention is everyone's business. Zero is a concept and a set of approaches that means that we continually strive for zero suicide. It's not a performance target, and it's not an opportunity to place blame. I think that's really important to highlight. We recognise that suicide is preventable, but that doesn't mean that every suicide could be prevented. We do recognise that suicidality is complex. And what we've done is we've adopted the key elements for zero suicide approaches that were set out by the Royal College of Psychiatry, because trusts that have adopted these approaches have actually found that they've been able to reduce suicide. And I think a lot of these are reflected in a lot of the work that's going on across the trust and also within our values. And that all feels quite positive, really. And Towards Zero Suicide is our commitment to suicide prevention and providing compassionate, person-centred care based on evidence, clinical knowledge and collaborative decision making. It's not about doing one thing for everybody, and it's not about defensive practice or any of those things that I know people worry about. Can I have the next slide, please? So this is just an overview of our framework, really, and the things that, like I say, that we're committed to. So we've got 4 key areas of our framework. That's community and partnerships. That's a lot of work that's been going on locally and across the trust and with local partners. Clinical practice and pathways. So that's how do we know that what we're doing is good practice in terms of suicide prevention, and that people get to where they need to be and that services are responsive to them. Just a restorative culture, because we need just a restorative culture in order to implement zero suicide approaches, and clinical competence, which focuses on training and making sure that staff are equipped for, to be able to do that work that we need to do, and developing skills to respond to self-harm and suicidality. Can I have the next slide, please? So I mentioned that the theme this year was about creating hope from action, and these were some of the things that people told the National Suicide Prevention Alliance that hope meant to them. It's very different for all of us, but I just really liked sort of sharing this as a concept, because hope can be quite complex within suicide prevention, particularly if you've been impacted by suicide, as many of us have through work, family bereavement, friends who are suicidal. We can be touched by it in all sorts of ways, can't we? It can be very difficult to think about hope when most people who are suicidal are actually experiencing great hopelessness. If I can just have the next slide, I actually drew this picture a year ago when I got a bit frustrated with all the images that I saw of suicide when you Googled it, or suicide prevention. As someone who has experienced family bereavement and worked with suicide for people who are suicidal for many years, this is a bit more accurate to me as to what it looks like or can be like, that hope is constantly changing, and actually sometimes we have to really take a step back and see the whole picture that's going on for somebody in order to try and find those things that we need to work with to try and help promote hope. And that's not to say it's that straightforward at all, but I think there are so many opportunities within suicide prevention, and I often get asked how I can have a job that focuses on something like this every day. And what I say is because there is so much hope, and there is so much that we can do, and so much that we can do that isn't a really involved clinical intervention. It's often about making connections and just trying to listen to people and sit with them where they are now. Have the next slide, please. So just wanted to pick up on the fact that there is a lot that we know about suicide prevention, and there's an emerging evidence base, and we're learning a lot from incidents, but also sharing good practice. And there are national studies that have identified various things that are on there in terms of the toolkits from NCISH. That's the National Confidential Inquiry of Suicide and Safety and Mental Health. And there's lots of work going on across the trust, lots of things that staff are doing on a regular, continual basis. And also it's very difficult to measure some of the positive outcomes. Sometimes we focus on the times when things don't go so well, and we need to do that because obviously every death is a death too many, and everything has an impact. But we also sometimes lose sight of the lives that we save and the good work that's going on too. That box on the right shows some of the learning that we've done as a trust, and really tying that into making sure that we ask about internet and social media use within assessments, suicide and autism. We've got some key messages that are going to be coming out soon around that, some work that's going on in the trust. Family involvement is really important. Some learning that we've done from the pandemic. So I'm always being asked about what's happening with suicide rates in the pandemic. They haven't increased as we feared they might, but that doesn't mean that people aren't in greater distress, and we know that people are struggling, and we know that clinicians are dealing with a lot all the time. And we're also doing some, looking at some thematic reviews around other topics that are coming up too. But that's just to identify some of the work that's going on and some of the learning that we're doing as a trust. But But if I can have the next slide, I think really it's about focusing on what we can all do to help prevent suicide. And I often get emails saying, I'm concerned about somebody, what do I do, where can I seek information? And I think this is the stuff that we can all take away, is that, you know, we all have a role to play, and we can all respond to somebody who we're either concerned about, who's reaching out, but also reaching in when we're concerned about someone too. And we don't know that we need to be able to have a conversation about suicide until we're in it, having it. So I think these are really key things for us to be aware of, about, you know, asking about suicide, listening, like I say, being there with a person, taking all suicidal thoughts seriously, removing access to means wherever we can, offering support in developing a safety plan. And that's not just for people that we work with, that could be loved ones, that could be family, friends, that could be ourselves. And that's really important to bear that in mind, that we're all impacted by suicide. Reviewing and updating any existing plans, encouraging people to talk to someone they trust, and also looking at other support available as well, because there's all sorts of support available. And if I can have the last slide. We now have suicide awareness, non-clinical level training on ESR for all staff. This was put together by the Zero Suicide Alliance and just covers some really good examples of what you can do when you're concerned about somebody, how you can listen, you can signpost, and you can also go through safety planning with somebody, because, like I said before, you know, you often don't know that you're going to need to have that conversation until you're in it, thinking, oh my goodness, what do I say? How am I going to support this person? And it's training that takes less than 30 minutes. And I think it's been really useful. And one of the things I share the most when people email me from across the trust. But that's really what I wanted to touch upon today, and, you know, happy to take any questions. Also very keen to make sure that we have engagement and share what you are doing in your areas. So to let me know, or, you know, let anyone know, but email the suicide prevention email address and we can capture some of that and share it across. Thank you.
Anne-Marie,
you're on mute.
Thank you. Thank you to my colleagues for telling me I'm on mute. So just a huge thank you to Rachel. A difficult subject, but very well presented, and some fabulous work that we're doing across the trust. And also I know Rachel's very well connected into the regional and national work as well. So it's just a big thank you there. We have had some questions put in to the chat. So a massive thank you to those of you putting in the questions. The first one is an anonymous one, but that's absolutely fine, because I think it's still a very good question, and I'm going to ask Lorraine to answer this one. So Lorraine, as we have a large number of staff working remotely, will this give us an opportunity to review the estate with a view of the SIPs you mentioned?
Thanks, Anne-Maria. So absolutely, categorically, yes. So we've, each of the divisions, as well as our corporate services, have set up in them an estates forum, and that estates forum is now systematically considering what we're calling the reform of all of our services. So what space does every function and every service we provide need in the longer term to operate from, with a view to, over time, that meaning we need less estate than we've already got. Now, I know some of those conversations are difficult conversations. Desk space and where we provide services from can often be contentious, but we are working through those, and we will continue to do so. It will take us a long time. We've got a lot of sites, but absolutely, yes, we're on with that.
Thank you, Lorraine. And I've got another one that's in a similar vein. Hi, Lorraine. Do you see a reduction in office space in the future? Yeah.
So as a result of that, yes, I absolutely do. I think we can use less space, and we've already seen that with some of our space at Lichfield Lane. We've consolidated quite a number of teams into a more of a hot desking and meeting space kind of environment, and I think we do see more of that.
Okay, so the next question comes from Neil. Actually, this covers quite a few different portfolios, so we may want to, Lorraine, you might want to start and see then if anybody else wants to pick some of it up. So how does making significant savings sit with the shortages we have in frontline staff? Trade union reps are often having concerns raised now about shortage of staff, It seems to be a common now for there to be only one qualified on shift, for example. Is this acceptable? Can I just say no, I don't think it is acceptable, but let me carry on with the question. Is it safe, and what is being done to protect staff health, safety and well-being? So I think there's a couple of bits in there. Lorraine, if you could start off, I think maybe Claire could answer some of the health and well-being, health and well-being bit as well.
Thanks, Anne-Maria, and thank you, Neil, for the question. So first and foremost, absolutely, I will state right now that our savings is not at the expense of the quality of the services that we deliver. Absolutely, categorically not. All of the savings that we identify go through what's known as a quality impact assessment, a QIA, and those are overseen by Anne-Maria and Sue Elcock as well, to absolutely make sure that we make savings in an appropriate and safe way. So that's the first thing that I would say. On the bits about shortages of staff, specifically, I would say that in no way in setting our financial plan would I be recommending, and nor am I saying that we will in any way pause any form of recruitment or stop what we are trying to do in terms of filling where we've got vacancies. So absolutely that. I just want to make that message clear. I don't know, Anne-Maria, do you want me to come back to you or Claire?
I'll do the middle bit. I'll do the middle bit, and then Claire can do the end bit. So the middle bit of that question around, is it acceptable to have one qualified on shift? No, it's not acceptable. And we work really, really hard to do establishment reviews twice a year to ensure that we know what the right number of staff there should be on shift. And then if we go under or over that, we flag it and we do fill in incident reporting to ensure that we've got a good log of when that has happened. It is not acceptable to have understaffing based on the establishment that there should be there. A lot of it is down to the fact that we do have vacancies. We do have staff that unfortunately are sick at last minute. We are trying to cover shifts with bank and agency, and we will always do that. We will not stop from doing that. So I just wanted to reassure, really, there's nothing from the executives and senior leadership team in this organisation that says you can't bring staff in to fill shifts. There's nothing. So we will absolutely continue to try and fill shifts as we can. But I'll give it to Claire, really, with regards to the health and well-being of staff.
Yeah, thanks, Anne-Maria. Well, I think actually the points have been made that issues that we've got around staffing capacity are not linked to money. So it's important that those things are divorced. We have had in the last couple of months have been particularly challenging around staffing capacity. In terms of, we've had a number of people taking much needed annual leave, which of course is really important to support the health and well-being. We've had sickness absence and we've had COVID isolations that have all compounded the issues, and colleagues will know that we have got some vacancies across the organisation. In terms of our strategic risks, it is regularly discussed and reviewed at the board, and it's also kind of explained in terms of our risk register. So it's something that we are very conscious of, and as an organisation continually review and assess. As the health and safety of our colleagues is of paramount importance to all of us, and we do everything that we can to try and ensure that as much as we can. And the health and wellbeing offer that we've got within the organisation is there. It's designed to support from a preventative perspective, but also from the perspective of supporting staff when they do become unwell. And just to remind colleagues that we introduced the health and wellbeing offer in April of last year, and I think it's gone from strength to strength, and we continue to build on that across the organisation to ensure that where we can, we support staff to remain as safe and as well as they can be. But I think that it is fair to say that we are very, very aware of some of the staffing challenges that we've got and that we've had in the last couple of months, and we're doing all we can, including working with our staff side colleagues, to mitigate those issues as much as we possibly can.
Okay, so just to say a huge thank you to Lorraine and Claire for that. Just one last thing, we do discuss staffing at all our boards, all the trust boards. There is a real in-depth discussion, conversation, challenge at board as well. We have got some more questions in the side, but we'll take those on the next question and answer section. I'm now going to hand over to Claire Claire Tini, and she'll go through her section, please.
Hi, thanks. And as Anne-Marie said, thanks for the slide and reminding us who we are. Seriously, it is useful because the days are busy. So I'm Claire Tini. I'm the Exec Director of People and Culture. And in this section, I just want to give everyone a bit of an update on the NHS People Promise and the National Staff Survey. So I'd like to take the opportunity to do that if I can. The NHS People Promise was launched last year. But actually, it's probably not had as much profile as it could have had. Some of that has been a bit overshadowed. So it is something that I think you will see more broadly across the NHS, but we're really keen to introduce into the consciousness of the organisation. It sets out 7 themes, and those themes are aligned to a lot of the things that we're doing within the trust in response to the feedback we've had from you. And the ideal of the People Promise is to really raise the profile of importance of people and staff that work in the NHS. And I don't think sometimes in the past we've necessarily had the visibility around that and the importance of staff and the contribution that they make. So it's a national programme to unite a number of initiatives to really support our staff around 7 common themes, and they're set out on the slide for people to see. Next slide, please. In terms of some of the things that we've already done within Nottinghamshire Healthcare that align to the NHS People Promise, they're sort of set out there, but I'll just pull out a few things. You'll know that a couple of years ago we relaunched our trust values, and we've done quite a lot of work around supporting equality, diversity and inclusion. There's still a lot of work to do to improve the experience of all of our colleagues across the trust, including from and specifically from an equality and diversity perspective. But we have done some good work to really start that. So the BME staff network goes from strength to strength, and we've just had some conversations this morning about other networks that we actually want to start to launch across the organisation. So hopefully we'll be able to update on that as well in the next couple of months. And we have got a number of colleagues that are part of parallel learning partnerships. These were previously known as reverse mentoring sessions, and a number of the executives in the organisation are working with colleagues in that partnership. I find the partnership that I am hugely beneficial, and I learn a lot from my mentoring partner in terms of that arrangement, and I think that we'll continue to expand that. In terms of reward and recognition, we'll all be, I hope, familiar with the Oscars, and despite the challenges of not being able to get together in a venue to have that awards ceremony, we've done 2 virtual ceremonies now for the Oscars and made sure that the winners have all got their awards, and that's gone really, really well. And Positive Stars continues to go from strength to strength as colleagues nominate each other across the organisation for the good work that goes on, and I think we've got a section later on today around that. Having a voice that counts, we do run a number of listening forums. I'll come on to the staff survey shortly, and we also do a number of pieces around freedom to speak up. And you will know, if you've been on social media and read the daily comms, that Simbi has been appointed as the Freedom to Speak Up Guardian across the organisation, and she's doing some great work around that programme. Keeping us safe and well. I just touched on the staff health and wellbeing offer, and as of the beginning of next year we will also be strengthening that offer by having our own dedicated occupational health service, which I think will only serve to bolster the existing service that we've got. Couldn't go past that section without mentioning vaccinations, which has been a bit of a theme throughout. John touched on it at the start. in terms of school age programme, but the booster vaccination programme for COVID-19 has now launched, and if you are 6 months past your second jab, you can now have your booster jab. The National Booking Service will be have a link on it soon that will enable you to book at a number of places to receive that. Although in the staff comms last week, and we will be putting it out again, there is a link because you can access your booster vaccination now if you're eligible at Sherwood Forest Hospital Hub. So I'd encourage you to get that as soon as you can, as soon as you become eligible. In terms of always learning, we do run a number of leadership and learning and development opportunities. It's not listed there on the slide, but I would just like to give a plug for what is now the Vision 27 programme. So that's the learning and development programme that we have for Band 7s and 8As within the organisation. We relaunched that within the last week or so. All the details are on Connect, so if you do want to book onto a future cohort, I'd encourage you to do so. And we've done quite a lot of work around flexible working and flexible hours. We've still got some focus to do around people that are carers and work with us in the organisation. That's a programme of work that we're committed to enable greater flexibility in terms of the way that people can work when they've got caring responsibilities. And the final thing, just to illustrate a couple of examples, is around being a team. And I think we've done quite a bit of work to build our ethos of us being one organisation and one team here at Notts Healthcare. I still think there's some things for us to do around that, but we're really conscious that we want to build that whole sense of being part of a strong team and a strong organisation in terms of the work that we do here, the Trust. Next slide, please. So, as well as raising the profile around the people promise, the other reason as well that I wanted to illustrate that to you now is because we are due to launch this year's staff survey. So the National Staff Survey comes out every year. It's launched in October. This year's launch date will be the 4th of October, and for the majority of people that will be going into your email account, so please look out for it on that day and take the opportunity as soon as possible to complete the survey. Huge thanks to the 4,000 plus colleagues that completed the survey last year across the organisation. We got some really rich feedback, and it does influence the decisions that we take within the organisation and the things that we prioritise. So it's really important that you take the time to do that and have your say, and I would encourage you to do that. It doesn't go without saying that we usually run the survey with a little bit of friendly competition. So we do, the survey is completely anonymous, but we do have a sense of the number of overall responses that we've got, and prizes will be distributed throughout the month as the survey runs. So look out for that, and look out for John's comms, because I'm sure he'll be updating on it. But the reason to flag it is you may see the survey just looks a little bit different this year to other years, because the questions are themed around those 7 themes in the NHS People Promise. So it's the first time that the questions have fundamentally changed in over a decade, but they are themed as a consequence of feedback that we've had previously on a national level around those themes. So it may look and feel slightly different, but I'm sure that there'll be the opportunity within the survey for you all to get your point across. And you can be one of the 600,000 people sort of nationally that does complete that survey every year. So yeah, please do take the time. Next slide, please. So just finally, I just wanted to say a couple of things about, and based on your feedback previously on the You Said Together We Did. And these are not all the things that we've done in response to your feedback around the staff survey, but they do illustrate a couple of things, and I covered some of those earlier. So the feedback around staff networks has been really important. We've picked up on that with the BME network, and we will take that forward and roll out others. I've talked about some of the leadership work, and particularly given a shout out to the Vision 27 programme. And the other thing that has been really influenced by all of your feedback has been the work that we've done around health and wellbeing. And the slide illustrates the support that we've been able to put in, with nearly 10,000 colleagues that have contacted the service and received support since it started in April of last year. I think that's it for me on the survey. I'm being plugged to say I'm running over, so I'll finish there.
Hello everybody. So thank you so much for that, Claire. I think that they're suggesting that we go straight into Becca. Becca Bracken, who is the Clinical Operations Manager, who's going to do a presentation and tell us a little bit about the memory assessment work that they've been doing. Thank you, Becca. Over to you.
Hi, thank you very much. Hi, I'm here to talk about memory assessment services today, and it's really nice to be here to present a good news story considering all the pressures that everybody's experiencing at the moment. So memory assessment services sit within the Msnap Directorate, and it's a clinic-based service for people who are over the age of 65 who require assessment or potential diagnosis for dementia. Next slide, please. So just to set some context, the memory assessment services year on year have just built and built and built on their waiting list, and it's just got bigger and bigger and bigger. And this has seen a real increase in complaints from patients, carers and GPs. It's been escalated to local MPs who've, requested information on why their constituents have to wait so long for this service. But the biggest impact really has been seen on patients and carers themselves, who are sitting on waiting lists requiring this assessment and potential diagnosis, who will deteriorate. Their mental health and cognition will deteriorate whilst they're waiting, and they won't get that access to treatment, which may halt the deterioration of their mental health. So timely assessment and diagnosis for these patients is really essential. And we're really struggling to meet the demand of the referrals that were coming through compared to the resource that we had available and capacity within the service to meet that demand. So I know predecessors and colleagues over the years have discussed with commissioning colleagues around the memory assessment services and how we can manage it. When I came into post a couple of years ago into the new senior management team, it was a real focus for us around what we could do about reducing those waiting lists, and we started discussions again with our commissioning colleagues around that. We presented a business case towards the end of 2019, which was really extensive and was based on capacity and demand modelling for the service. So what do we actually need to meet the demand that's coming in? And that was actually agreed, investment was agreed around about March 2020. But of course, as we're all aware, the COVID pandemic hit us around that time, and we had to make the really difficult decision to close the memory assessment service at that point, to redeploy staff into other areas where we required the staff to support safe staffing services. So we closed memory assessment services at a time when we were really pleased that we'd got the investment. We were really enthused to make a start and have a go at this new model of care and getting people going. So we were really keen to reopen the service as soon as we possibly could. And in the beginning of July, we decided to start working on a reopening and discussions about how we could do that within our services. So we triage. We had 810 patients waiting for memory assessment at that time, and we triaged every one of those patients and prioritised them on a level 1 or 2 priority to start booking them in to clinics, but virtual clinics at that point. Of course, we had to also think about how we were going to work very differently because of the restrictions related to COVID. Next slide, please. Yeah, so as I said, we had the agreement for the investment. We started planning, we started recruiting to the new model of care. So we had investment for a new MDT model of service. So previously we had a nurse-based model, and with the new investment we had resource for psychiatry, psychology, occupational therapy, some additional nursing posts. And importantly, we had funding for a team leader, because previously our memory assessment nurses were all based geographically and worked to the community mental health team leader. So they weren't actually working as a team. They were all working quite independently and working very differently in each area. So it was really important that we looked at this new model, bringing them together as a team and focus on embedding consistent practice across all the areas. We reopened the service in August 2020, and it was really worrying for staff because we were doing it purely on a virtual level. So the introduction of MS Teams, one consultation, and also attempting to do assessments via the telephone, which was really difficult but really successful. So what we've seen is a significant reduction in waiting times since that time. So like I say, in July 2020, we had 810 patients waiting, and we had a 44-week average wait time for assessment. If we could just flick on to the next slide. So this shows the reduction that we've made. So you can see the highest peak there at 44 weeks at that time period. We're currently around just under 11 weeks. So we've had a huge drop in 12 months. So it's absolutely amazing. I'm astonished at what the team has actually done to get that waiting list down in a relatively small amount of time. In a period where everybody has been really struggling with delivering new ways of working, etc. So it's been absolutely phenomenal what they've done as a team. If we could just flick back to the last slide, please. So we're now on target. So we have a target to get down to 8 weeks from referral to assessment by January 2022. So we are on target to meet that. We've seen a little increase in referrals over the last few months, with GPs seeing more patients face to face. So that has impacted currently on our average wait list, and we have sort of hovered around just under 11 weeks for a couple of months now, and we're working now on getting that down to 8 weeks by January. Our ambition, in line with Msnap accreditation, is to get down to a 6-week waiting time from referral to diagnosis. So that's quite a big ambition and a requirement that's been made from our commissioning colleagues that we need to work to by the spring 2022. And again, our ambition is to work towards Msnap accreditation for the whole MAS service. Locally and nationally, we've had a lot of interest about how we've achieved this significant reduction in waiting times. NHS and I put my teeth in, have I spoke to them a couple of weeks ago. They were really interested to know how we've actually done it, what's been the biggest factors in that. So it's a really good news story. I'm so proud of the team for how they've worked relentlessly with a passion to get this waiting list down, to ensure that our patients and carers get a timely assessment and diagnosis. Thank you. Oh, sorry, I missed that slide. It's just that's a our current referral rates and patients waiting.
Anne-Marie, you're still on mute.
Thank you so much, Becca. That was great. I've actually got a question. So do you think I could come straight to you, please?
Yeah, of course.
So basically the question is, where did you get the investment from? Was that from the Trust, Notts Healthcare, or was it from a system, regional or national funding?
It was from the CCG, yeah, so the system.
Okay. We've also got a question that unfortunately I think Lorraine has gone, but I just want the person to know that we've not ignored the question. So it was around, would we be able to do non-confidential document printing whilst at home? So what we'll do is come back to you, because I think it's a really important question, and we'll be able to answer that, because I think that a lot of people are wondering the same thing. The next question, I think Lorraine kind of answered it. I'll just make sure that I've fully done that. So will more office space be closed down for a more hybrid hot desk working environment? I think she answered that. You know, the intention is for us to rationalise the estate that we have. We work across more than 130 I would say 130 venues, so it makes sense for us to rationalise the estate that we do have, and that's very expensive. So a lot of our costs go on the estate that we have. The next question from Neil, noting, I'm going to come to Claire for this one. So Claire, noting that low staff turnover is seen as one of the things to support reducing suicide, how can we reconcile the fact that in parts of the Trust we have very high staff turnover? For example, one of my members spoke to me yesterday about concerns in part of the prison health, where in the last 6 months they have had 28 staff leave. I'm not sure if you're able to answer all of that, but can you have a start?
Yeah, I can have a start, thanks. So I think Neil's right that in some parts of the organisation we have experienced higher turnover than we would like. Some of the reasons for that are driven by labour market choices that people can make. As we've said, some of the shortages for key posts mean that people have got a lot of choice about where they work, and whilst we do a lot to help support the retention of our staff, that is a factor for us. Overall, as an organisation, our turnover has reduced and less people are leaving than they did previously, and indeed a number of colleagues that retire do also come back and return to work for us. So comparatively speaking, we do fare quite well. But if there's anything else that people think that we can be doing to support reducing those turnover levels, then please do let us know. We do work very hard at it. And the questions from Neil, he will know that we work very hard with our colleagues and staff side to try and do what we can. I can't comment specifically on the correlation to the issue that was raised about suicide, but perhaps Neil can clarify a little bit more around that.
Yeah, thank you for that, Claire. And another one around staffing and staffing pressures is a better communication for all staff on the Trust strategy and action plans to improve safer staffing would be very beneficial, as frontline staff are now very tired with continual staffing pressures and little feedback. I think I would just like to add to that is that I don't want people to think that we don't talk about it all the time. So at our executive meetings, at the board, at our committees, at the Safer Staffing meeting that is held on a regular basis, and within each of the clinical divisions, staffing and our action plans to improve our staffing are talked about on a regular basis. And I just want you to know that we do recognise your operational directors are fantastic at raising that awareness, and we are working very, very hard to try and sort of like resolve in some areas. Sometimes we won't always be able to resolve, but just to make it a little bit easier. But I want you to know that we know that it's hard out there, and we are really, really working as hard as we can to make it as easy as possible. So I just want to say a massive thank you for all the hard work you do, but we haven't got the answers to everything at the moment. So Louise has put in there about the applications for Vision 27. So there's a really good links in there as well. And I think there's a question for Becca. What is MSNAP?
It's Memory Service National Accreditation Programme.
You need to know Paul Devlin is brilliant at pulling all of us executives up for our acronyms. He hates it. He's very, very good at making sure we never ever do it in any forum whatsoever. And some really lovely comments on the side there as well. Just thank you to all of the presenters today. It's been absolutely brilliant. I think that's pretty much the questions we've got so far. I can't see any more. If I have missed any questions, huge apologies. And we will pick them up. We absolutely will pick them up. I won't ignore them. So I think with much further ado, we're able to go over to our positive stars. You can see we've got a slide coming up now. So our positive stars. I'm actually going to hand over to Paul Devlin, who's going to be able to tell you a little bit more about this.
Hi everybody. So just a couple of slides. As you can see, in July, we had with this last, is that the accurate slide, colleagues?
July.
Somebody's saying July on it. So I'm getting a yep in the chat bar here, so that's great. So 32 individual nominations, 3 team nominations. Please keep sending these through. It's a really, really great opportunity just to recognise colleagues. I know when you know that you've actually been recommended for this, that's a real positive as well. And I mentioned right at the start of this session that I'd been over to Gartree Prison, and this is why. Much to his surprise, I have to say, I was able to go and present the positive star to Dr. Shamar today. And just there's a bit of a story there about this. The key for me was there was a very serious self-harming incident that was genuinely life-threatening. The team, of course, responded incredibly well, but what they also saw was Dr. Shamar really living the values of compassion and teamwork by really focusing on his colleagues in the team about making sure they were doing okay after what had been a particularly challenging incident. The team were really, really excited about recognising him, and it was a joy to be able to meet Dr. Shamar and the team and just share in some of their delight and positivity about him. So please do keep sending through those positive star recommendations. Thanks very much, Anne-Maria.
Thank you. Thank you, Paul. That's great. And it's really lovely, actually. There's a couple of comments. It's lovely to see all those photographs. And I don't know, that gives me a little bit of a warm feeling. That's really nice. And it's nice to see a picture of somebody without a mask on as well, because I didn't actually know that that's what he looked like. So it is nice, isn't it, to recognise over and above, and sometimes, you know, it's all right to recognise the normal as well, because everybody does a fantastic job every single day. And Paul has said, you know, like seeing people in 3 dimensions is really different as well, isn't it? Because we only see the front of people all the time. So pretty much in summary, I think this new format has gone down really well. It seems to have worked. We've had plenty of questions in the round side. I was worried that we wouldn't get any questions, but actually people have really taken part, put some nice questions in there, some really relevant stuff as well. So that's been nice for us to be able to answer those. We do encourage people to come to Connecting Knots. It's a way of seeing the chairman, the chief executive, horizon scanning, get to see some fantastic work that's going on across the organisation. And in challenging times like COVID, we all think things are really dire and it's, you know, nothing good is happening out there. Well, actually, some really, really good stuff is happening out there in this trust. We should really be proud of the work that we do and proud of the work that all the staff are putting day in and day out for us. So a massive, massive thank you to all the work. Massive thank you for what you do. And I would just like to say good luck and with everything that you do. And thank you very much indeed. All right, take care, everyone.